Hi, good morning, everybody, and thank you for joining today's session. My name is Catherine Connolly. I'm the Community Relations and Engagement Coordinator with Seniors NL. Welcome to this week's Let's Talk About Hearing Loss, the Ear and Beyond. I'll introduce our guest speakers now in a few minutes. A big thank you goes out to the RBC Foundation for supporting this Zoom session, including the sign language interpreting services. Now, a few housekeeping tips. Please mute your mic to block out any outside noise. Click the closed captioning button on the bottom of the screen. You can certainly go ahead and put your questions and comments in the chat. We will be monitoring this throughout the call, and we will have an opportunity for questions and answers at the end of the session. This session will be recorded and placed on our YouTube channel for future viewing. And if you have any presentation requests, please don't hesitate to reach out and let me know. Barb, can you please go ahead and read the land acknowledgement?
I'll mute myself. Sorry. We respectfully acknowledge the land on which we gather as the ancestral homelands of the Beothuk, whose culture has now been erased forever. We also acknowledge the island of Ukta-Umguk as the unceded traditional territory of the Beothuk and the Mi'kmaq. And we acknowledge Labrador as the traditional and ancestral homelands of the Innu of Nitassinan, and the Inuit of Nunatsiavut, and the Inuit of Nunatuavut. We recognize all First Peoples who were here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all.
Thank you so much.
You're welcome.
Now I'd like to introduce our guest speakers. Karla, graduated from Western University with a Master's of Clinical Science degree in Audiology in 2010. Upon graduation, she pursued training in tinnitus retraining therapy, TRT for short, and returned home to Newfoundland to practice at her family's hearing clinic, Maico Hearing Service. Sorry about that. She loves working with people and is always inspired by their stories about how their lives have changed after hearing and tinnitus treatment. She generally cares about her patients and will go above and beyond to reach each person she works with. In her spare time, Karla enjoys traveling, watching movies, reading inspirational books, and spending time with her family and friends. We also have Ian, and Ian, I'm going to go ahead and stop sharing my screen so you can start sharing yours while I'm reading out your introduction.
Sure.
There you go. Ian's interest in the field of audiology stems from his long life love of music and his fascination with the brain. Playing musical instruments and having a love for sound as a whole, along with studying behavioral neuroscience at Memorial University, led Ian to his passion for helping people better their hearing health. Ian completed his Master of Clinical Science in Audiology at Western University in 2020 and was eager to return to practice in his home province, joining Maico Hearing Services team of experts in the fall of 2021. His favorite thing about being an audiologist is keeping up with advancements in hearing technology and seeing the positive impact that it can have on his patients' quality of life and their overall well-being. And I'm going to go ahead and pass it over to Karla and Ian.
Thank you, Catherine.
Well, first of all, I wanted to say thank you very much for having us today. I know that myself and Ian both really love the opportunity to talk about what we've learned and especially how much has happened in the field over the past few years. There's been a lot of research and advancements, and we just love an opportunity to share that with others and educate people, not just about hearing, but all that we've learned about how hearing can affect your brain and your overall well-being.
Absolutely. And please let us know if there's any issues with the sound quality, our picture, anything like that throughout the presentation.
Will do.
So just a little bit of background about our clinic. Maico is a family-owned full-service audiology clinic that has been in Newfoundland since 1969. It was actually my grandfather that started it then, and my father took it over later. And now I'm the third generation involved. And we do have locations across the province. We have one in St. John's, Harbor Grace, Gander, Grand Falls, Windsor, and on the West Coast in Corner Brook. And one thing I like to share about our team and our clinic is that we are all really committed to the overall well-being of our patients, so that we don't just focus on, selling hearing aids or products. We really like to expand and make sure that we're helping people treat their hearing loss, manage their tinnitus, and really improve the overall quality of their life as a part of the hearing care that they receive. So a little bit of background about what an audiologist is. I've said to people in the past that I'm an audiologist, and sometimes they said, "Audi what?" So just a little bit of background about what we are and what we do. We are regulated health professionals who have at least a master's or doctorate degree in audiology. We do provide individualized care to meet the needs of people across the lifespan with hearing and with balance issues. So the next slide just shows a little bit more detail about the services that we do focus on. So right at the top, you can see we do assess and diagnose hearing and balance issues. I think that's something we're known for is that assessment and hearing testing and balance testing piece. We also fit and prescribe hearing devices. So after we've assessed and diagnosed our patient's needs, we'll find out exactly what type of hearing loss they have, if hearing devices would be appropriate, or maybe another type of treatment. We'll prescribe the best, brand and technology style and any other technology that might be appropriate. And we take the time to measure and fit and fine tune that, especially for our patients' particular needs in hearing. Another really big part of our job that a lot of people may not realize is that there's a lot of counseling and interventions and support involved. Treating hearing loss is not a one and done scenario. You really need to take the time to involve your family, other people that are affected by your hearing and that are communicating with you. And you need to come in regularly for not just assessments and rechecks, but for counseling and maintenance and support and advice on where you should be at that point in your hearing journey. We also offer therapies for tinnitus and sound tolerance issues. So tinnitus, for those of you who don't know, or tinnitus is another pronunciation that's also correct. That is when you're experiencing sounds like ringing, buzzing, whistling, rushing any type of sound like that inside your ears that others can't hear. It's very common when you have hearing loss, but you can also experience it with normal hearing as well. I have it myself. I don't have any hearing loss at this point, but I've been experiencing tinnitus now since I was in my early to mid 20s. So it's quite common, and that is something that we in our clinic focus a lot on is tinnitus retraining therapy and helping people with their tinnitus. And sound tolerance, sometimes the problem is not that people can't hear well. Sometimes the problem may be that they're too sensitive to sounds, whether that be louder sounds, certain pitches of sound, or even specific soft sounds might be bothersome to some people. So that's something that we can help with as audiologists as well. Another area that we're really interested in and is really helpful to the hearing industry is hearing conservation. We like to get out and educate people in the workplace about the dangers of noise exposure and how to identify when they need hearing protection, what type of hearing protection they might need, and to monitor their hearing regularly so that we can identify if people in the workplace are losing their hearing, and we can be consultants for people in an industrial setting as to what can be done to help protect people and avoid that type of hearing damage. And another area, like I said earlier, Ian and I are really passionate about education and advocacy. I think that as audiologists, it's our responsibility really to let people know about hearing and how it affects your overall life and what can be done to not only treat it, but to prevent it as well.
So now that we know all of the roles and responsibilities of an audiologist and what exactly they are, there's a lot of different signs of decreased hearing, social, emotional, and even medical indications of hearing loss. So let's go through the social side first. So a sign of decreased hearing that someone may experience or a loved one of theirs may experience is if they have to ask for repetition frequently. Sometimes you may need repetition 2 and 3 times and still not be able to get the full picture of what's being said to you. That can be a sign of a hearing impairment or an issue with your hearing. Difficulty following conversations in a group setting. A really common thing that I hear is that, well, in one-on-one conversation, I'm perfect. I can hear without issue. But any more than 3 or 4 people around me talking all at once is where I really start to struggle to hear well. Feeling that other people sound muffled or are mumbling around you. And sure, some people are definitely low talkers and mumblers. But if you feel that that's a trend of everybody around you and everybody is mumbling, then it's definitely a good idea to have your hearing assessed. Difficulty hearing in noisy situations, like a restaurant, shopping malls, conferences, meeting rooms, anywhere where there's a lot of background noise, that can be a sign of decreased hearing. Having particular difficulty hearing women or children. I've heard this many a times too. Say male voices, a little bit lower of a tone to them. Some people may have no trouble hearing them, but women or children with just a little bit of a higher pitch to their voice, people can have difficulty. And it can actually paint a picture of what your hearing loss may look like. If someone has their TV or radio turned up higher than others prefer around them, it's also a sign of decreased hearing. And lastly, mishearing or responding inappropriately in conversation. So missing the punchline of a joke, answering a question that you were never asked. Before too long, you may have accidentally agreed to build a shed with your next door neighbor, and you never planned to do that. So, it's all a little bit of fun, but still the consistent mishearing or responding inappropriately is definitely a sign that decreased hearing could be present for somebody. So that's the social side of it. And tied pretty strongly into that, there are some emotional markers of decreased hearing as well. When someone feels stressed or tired from having to listen for a long period of time, and they feel like they're straining, particularly in situations where there's background noise. This is a real term called auditory fatigue, and it's very, very present in a lot of people with hearing loss. They almost feel wiped after they have to listen with a lot of effort for some time. And that can cause irritation, annoyance at other people because of an inability to hear or understand them. It can result in embarrassment from misunderstanding what other people are saying, and even avoidance or nervousness around hearing or meeting new people. Those 2 points there really tie strongly into the final point on this page, which is the withdrawal from social situations that hearing loss can result into. Unfortunately, I have a lot of patients that have told me, say, just as an example, I used to really enjoy having a game of cards with a group. Every once a week, I would go and it would be a large group and we'd all get together and play cards and do things like that. But I'm not hearing as well in that situation as what I once was. And the more that happens to somebody, the less likely they're wanting to go and be in that kind of environment because they struggle with their hearing. So the withdrawal side of hearing loss is a really, really big thing that not everybody recognizes. And finally, there's some medical indications that someone may have decreased hearing or could be at risk for developing hearing loss. So having a family history of hearing loss, genetic hearing loss can come about at really early in life if there's a strong family line of hearing loss. But even if there's some age-related hearing loss at a certain point in someone's lives that runs in your parents or grandparents, at a certain age, hearing loss may start to develop as well. So there's a few different ways that family history of hearing loss can come about. There's medications that can harm the hearing system, and we call these ototoxic medications or drugs. Just as a couple examples, they could be certain kinds of chemotherapy, really strong kinds of antibiotics. There's not a whole lot, but definitely some can impact your hearing. Other conditions such as diabetes, heart, circulation, other cardiovascular problems, thyroid problems can also be correlated with hearing loss. If someone is over the age of 50, it's also a risk factor for having decreased hearing. At some point or another, whether you are 50 or 115 years old, your hearing may start to decline in some small bit. So even if you don't have any concerns about your hearing at 50, it's really, really good to get a baseline just to see where you are in terms of your hearing sensitivity. If someone has a history of frequent ear infections or other middle ear conditions, that can cause hearing loss as well. And it can cause some structural damage to the eardrum, 3 little bones behind it, a few different things that way. The next point here is a really big one, noise exposure. So being exposed to loud sounds over a long period of time, or a single exposure to, say, a loud, sudden, explosive noise, whether it be, well, yes, say an explosion or firearms use, anything like that. Noise exposure as a whole, or say somebody working in a loud environment with machinery and equipment for their entire life, that can really have an impact on someone's hearing too. And if someone has ringing in their ears, so tinnitus or tinnitus, that could be a sign of decreased hearing, and absolutely it's a good idea to have your hearing assessed. So there's a lot more factors that may go into having decreased hearing and signs to look for than people may realize. A few of them are summed up in this little cartoon here, and probably a lot of people relate to this. So it's what wives say is go to the store, lay down the mulch, wash and wax the car, get the kids at school, rent some videos, finish the rest of the dishes. And what husbands hear is go lay down and get some rest. So that's probably the selective hearing piece that I hear all the time. Very rarely is it ever just selective hearing, but a little funny one for you.
Okay, that's a good one. So I'll just share a little bit about the anatomy of the ear and how we hear. So this picture just shows different sections of the hearing system. So the outer canal, or that channel there, that's where sound is directed in the form of sound waves into the eardrum. And that little thin eardrum, that little membrane, it vibrates and moves like a drum. And it sends those sound vibrations in through the tiny little bones there in what we call the middle ear. They're the tiniest bone in your body is actually in your middle ear there. And that then gets sent into that little snail shape area. That's the inner ear, or the cochlea. And inside there are rows of what we call hair cells. And they almost work like keys on a piano. They pick up different pitches of sound and they amplify those sounds and send them up as electrical impulses up the hearing nerve to your brain. And this is the part that a lot of people are surprised by. It's the brain that's actually hearing, not your ears. Your whole hearing system there, your ear, from your outer ear, middle ear, inner ear, that just acts like a delivery system, just to pick up and deliver the sound to your brain. But your brain is actually where you hear. So there are three main types of hearing loss. So everyone's hearing is quite different, almost like your fingerprint. There are a lot of differences in how people hear and process sound, but in general, hearing losses are categorized into three different types of loss. So the first one, this is the most common one that we see. It's called sensory neural. And basically what that means is that the issue that you're having with this type of hearing loss is in your inner ear. So you can see on the first picture there, that whole inner ear that's highlighted in red, that is where the problem is. So the most common type of hearing loss, like Ian said, we see noise damage a lot. So those little hair cells that live inside the inner ear, when they're intact and there's no damage, they look like the picture in that A diagram there. You can see there's three little rows along the bottom of little hair cells that look very neat, very intact. Another row at the top, those are called inner hair cells. So those inner and outer hair cells there, you can see they look very, very intact, very neat. If you look at the bottom image in B, you can see that a lot of those outer hair cells, the OHCs, you can see there's areas there where there's some that are missing. There might be some that get bent or broken. If the hearing loss gets to a certain severity, you can even have some of those tougher inner hair cells become damaged as well. So this is the type of hearing loss that we see most often, and it is a permanent loss when you have damage to those hair cells in your inner ears. So the second type of hearing loss that we see often would be called a conductive hearing loss. So that's when you have an issue with the outer or middle ear. The outer ear, you can see the first image at the top there. That just shows a blockage of earwax in the ear. So a lot of people might not think that would affect your hearing, but if it builds up enough, or in that image, if it gets too close to the eardrum and impacts the movement of the eardrum, that can cause a loss of hearing. The good news is if it's earwax that's causing your hearing loss, it's a temporary hearing loss. So once we remove the wax, your hearing should be fine. The second example of what may cause a conductive hearing loss here, you can see the eardrum has a large perforation or hole in it. So if anything happened, maybe if you used a Q-tip and you went too close to the eardrum, sometimes if there's a really loud explosion or noise next to your ear, it could be loud enough that that could damage your eardrum. Or the most common cause we see is if you have an ear infection and you have a fluid buildup behind your eardrum, and it gets to a point where there's too much pressure there and it ruptures and comes out through the eardrum. That can cause a hole or a perforation. And then in the bottom image there, you can see there's some fluid in the middle ear. So that would also cause a conductive hearing loss. So that can occur when you have a cold or a flu, and you do have some congestion that builds up in behind your ear. And that can certainly affect, if you've ever had a cold or flu that's been accompanied by an ear infection, you know how uncomfortable that is and how much it can dull your hearing. And then if we look at the middle section of this diagram here, there's a third type of hearing loss called mixed. And that occurs when it's a combination of a sensory neural hearing loss and a conductive hearing loss. So you have some issues with your inner ear where those hair cells are, and maybe you have something else going on in the middle ear as well, or the outer ear that's causing what we call a mixed hearing loss. So that one, some type of genetic disorders can cause a mixed hearing loss. Particularly, there's one that's really common called otosclerosis that affects those little bones inside your middle ear. That one is a common genetic loss. You might find with certain infections, it might impact your inner ear and your middle ear, or even some head traumas. It might be enough to damage those little delicate hair cells in your inner ear, and it might cause an eardrum perforation or damage to the bones in your ear as well. Some other things on this slide that might be useful to know is the causes for the different types. So aging often is associated with a sensory neural hearing loss, noise damage, as we discussed. Certain drugs can cause that type of loss. Auditory tumors, so tumors in or around the ear, or a blast or loud explosion. And again, for the conductive losses, things like fluid in your ears, foreign objects in your ears, which we see sometimes, especially the cotton on the end of Q-tips. You should really not use Q-tips to clean your ears. Allergies, sometimes we can see that results in a conductive loss. The ruptured eardrum scenario, or impacted wax.
So now that we know all the different kinds of hearing loss, we'll talk now about their implications. There's a lot of different things that hearing loss can affect socially, emotionally, and we'll just talk about the social side of it first, because that's a really, really big one. And there's a lot of solid research that says that untreated hearing loss can give rise to a poorer quality of life. It can cause isolation for people, reduce social activity, and can lead to depression. Adults with untreated hearing loss tend to withdraw from engaging with family and friends. It's that example I gave of you used to love to go to a game of cards weekly, but because of a trouble with your hearing, you kind of withdraw and don't participate in those kind of social activities any longer. And we all know that, of course, isolation can cause and lead to symptoms of depression And further symptoms that way of depression can kind of start the cycle between isolation and depression. And not everybody really realizes how strong of a correlation hearing impairments can have on that cycle there. So really closely related to that is hearing loss and its relation to mental well-being. So in untreated hearing loss, there's evidence that shows that adults 50 and older are more likely to report anger, depression, anxiety and frustration, emotional instability, paranoia, and again, the big one is less likely to participate in social activities. And even outside of the realm of hearing care, there's so much research that indicates that good social connections and being part of social groups and spending time with friends, family, loved ones has such a positive impact on someone's overall health, well-being, longevity. So really that participation piece, social engagement, very strongly correlated with hearing loss too. There's really interesting studies about hearing loss in the brain. And this is a really big topic within the last 5 to 10 years. The brain naturally shrinks with age. This is proven time and time again. It's called atrophy. But the rate at which it shrinks can actually increase in individuals with untreated hearing loss. And we see the largest effect on the parts of the brain that relate to speech understanding, memory, and balance as well. Those 3 areas are really related in your brain. Untreated hearing loss may cause the brain to devote too much of its energy to hearing, and then less is left over for thinking, remembering, and learning new information. And it ties back to the auditory fatigue piece that I was talking about earlier, where you're in, say, a crowded environment, a restaurant, somewhere where there's lots of background noise, and you're really straining and honing in on what people are saying to you, trying your best to hear. That can really cause people to feel absolutely wiped out at the end of that. And so much of your brain's energy and resources is just devoted to hearing at your absolute best, and it can be a struggle that less is left over for any other processes. This is a really big topic and probably research that somebody has at least heard a little bit about within the last several years. And it's the link of hearing loss and dementia, other forms of cognitive decline. And it's a solid body of research that's mounted over the last several years. And an interesting finding is that normal hearing and a risk of dementia and cognitive decline with untreated degrees of hearing loss, the more that you get into the degrees of hearing loss, the greater someone's risk of developing dementia in comparison to someone with normal hearing or even hearing loss, but treated with hearing devices. So consider that someone with normal hearing may have a one-time risk of developing dementia. With each increase in degree of hearing loss from mild to moderate, severe, there's about an extra, I'll say, time or 100% kind of increase on their risk of developing dementia. So compare normal hearing with kind of a normal risk of dementia, but severe hearing loss having a 4 times risk of developing dementia. And on the side there is all of what I was just talking about. Individuals with hearing loss who do not have their hearing loss treated do indeed have a higher risk of accelerated mental decline. And the withdrawal from social activities is a big factor in that. A person with hearing loss, using hearing aids, having their hearing loss treated by a professional who are socially active and participating a lot, they're more likely to have a similar risk of mental decline to a person with normal hearing. And even further to this point, this nice colorful visual of the brain here, it drives home the same kind of points. So untreated hearing loss leads to less stimulation of certain regions of the brain. This can then cause an accelerated mental decline, a higher risk of dementia, troubles with remembering and problem solving, because there's certain areas of the brain that are just not as active as what they should be. Treated hearing loss on the other hand, improved communication with others. People are socially active, their brain is being stimulated, they're participating, they're engaging, and in simple terms, it keeps your brain fit. And so it's a really, really positive thing to do, well, of course, for your hearing, but really your overall well-being, especially the health of your brain, which is a big topic in the last few years.
Okay. So if you suspect you have a hearing problem, what should you do? The first thing that we would recommend is certainly to seek the help of a hearing care professional. If you have a hearing loss, that is a medical issue, and it's something that you should seek professional advice for, particularly to rule out anything more serious that could be underlying or causing the hearing loss. And there's a few things you should expect from your hearing care professional. The first is that they should complete a thorough assessment of your hearing and your listening needs. So that should involve asking you a lot of questions about your hearing history, your health history, what you've been noticing, where your biggest challenges are, where you would like to see improvement, and a very thorough test of all the parts of the ear that we reviewed earlier. Your hearing professional should also help you select the most appropriate treatment option for your needs, whether that's as simple as wax removal, whether it is some type of referral to an ear, nose, and throat specialist, further investigation if there's any other concerns or red flags identified. And once you've found the appropriate treatment with your professional, then your professional should provide ongoing support and counseling to help you over the long term to maintain healthy hearing. Monitor your hearing levels regularly, just as you monitor your vision, or you see your dentist regularly, or see your doctor for checkups. Monitoring, support, and counseling, maintaining things is really important in the long term. And as I mentioned earlier, sometimes it's just wax. Sometimes you might need some other types of treatments, like medical or surgical intervention. If you're somebody who is prone to pressure or fluid buildup in behind your eardrum, you may need to have some little tubes inserted in your eardrum, and that will relieve that pressure and congestion and help improve your hearing. If there's an issue with maybe one of the little tiny bones in your ear, it's amazing the surgeries that are available now for that. Even locally, our ear, nose, and throat specialists are actually putting tiny little prosthetic little bones inside of that little space in the middle ear, and repairing all kinds of things. Most often issues that are conductive hearing losses are treated this way. But there are other types of surgeries available as well. Antibiotics is a common one, especially if you have an infection, an ear infection in your middle ear. And steroid treatments, that's one that a lot of people might not know about. There are certain hearing losses that we consider urgent, and we recommend treating urgently. Particularly if it was a sudden loss of hearing. I experienced this myself, actually, so I can speak firsthand to this. I woke up one morning and noticed that one of my ears sounded a little echoey. Things just didn't seem right, and my tinnitus was louder, and just something didn't seem right. And I guess being an audiologist and being in tune with my hearing, I immediately had a hearing test and discovered that there was a certain range of pitches where my hearing had dropped. just overnight for no apparent reason. So we did a hearing test, got all the information we needed, and I was able to see an ear, nose, and throat specialist that same day. He put an injection in my ear, a little steroid injection in through my eardrum, and gave me a week of steroid treatments, oral treatments to take, and my hearing completely recovered. Now, if I had waited, days, weeks, months, the longer you wait, the chances of your hearing recovering in full get less and less. So certainly if you notice any sudden change in your hearing like that, that's something that you want to take very seriously and try to get treatment for right away.
Yeah, I think the effective window is within about 72 hours of noticing something like that. So it's definitely, as Karla said, a medical emergency worth seeing to.
Yes.
Right away.
And some other things that we recommend are auditory training. That's something nowadays it's great because we can do this online from the comfort of our homes. But a lot of times when you have hearing loss, particularly if you've let it go for a little while without treating it, you can really start to lose your ability to distinguish words well, particularly if there's other talkers in the room, other background noise, if someone is speaking quickly. Those types of challenging listening environments, sometimes you need a little bit more help. And auditory training really helps to train the brain to improve your ability to understand speech in those difficult situations. Implantable devices is another treatment now that's really come a long way. Some of you might have heard of cochlear implants, and that's when really your hearing is at a point where you have a lot of damage done to your inner ear, and traditional devices like hearing aids aren't very helpful anymore. So this type of implant, you have a piece that is implanted inside of your inner ear. You wear an external piece, a receiver outside as well. And that really has changed a lot of lives. People that really couldn't hear anything at all are able to, function, talk on the telephone, listen to music, have conversations with family and friends, when years ago that probably would not have been an option. And hearing aids and assistive listening devices, these types of technologies have come a long way as well. There's a lot more out there than just hearing aids now. There are other accessories that you can use for the television, to hear your phone, a lot of things that we can do that, again, we couldn't a few years ago. So hearing aids, we did add an extra slide just around hearing aids specifically. We do get a lot of questions about hearing aids, and it is still the most common treatment for that type of permanent hearing loss. So hearing technology that is fit and fine-tuned precisely for an individual's ear, hearing loss, and listening needs is what we call a hearing aid. Something that you can pick up over the counter in a drugstore or something like that, that is not specifically tuned for an individual's hearing loss. It's not a prescription device. It's not tuned for any specific situations. That's not considered a hearing aid. That would just be an amplifier. But today's hearing aids, they are quite advanced. You can get rechargeable hearing aids now, which a lot of our patients are really enjoying. There's no batteries to change. You just charge it up like you would your cell phone overnight. There are devices that are Bluetooth compatible. So what that means is you can connect your hearing aids with other things that you want to listen to, like your television or your cell phone, so that you get this sound sent directly into both ears. That's really nice and clear, almost like you're listening through headphones. And it really helps for people that have challenges on the phone. Some people might have to use speakerphone to get that extra boost. You don't have to do that with this type of technology. And even the television is a big one, because so many people find that one person in the house wants the volume of the TV a lot louder than someone else. And that can be challenging to watch TV together if that's the case. So these types of Bluetooth technologies have really helped in those situations in particular. They're a lot smaller and discreet too than they used to be. I'm amazed actually at how much they can fit in these tiny little computers nowadays. And you're also able to get devices that automatically adjust to your surroundings. So if you're somebody that likes to have your own control and you would like to pick your own volume level, then you can still get that. But the devices do a lot on their own now that just seamlessly transitions your sound and optimizes it as you move from one environment to another. So one question I often get asked a lot is, why do some people not do well with hearing aids? Why are some people's hearing aids in their drawer? And there's actually a lot that goes into being successful with hearing aids. And what we've found to be the secret is like a three-legged stool. There's three key pieces. So number one is the hearing technology you have. It needs to be the right technology for your hearing loss and for your listening needs. It also needs to be tuned properly and precisely for every pitch of your hearing and what you need as an individual. And another piece that is very important is that you have the right hearing care professional that's really going to take the time to use the advanced equipment that's available today to thoroughly assess your hearing and your needs, and also use the technology and the tools and the expertise that's available to properly fine-tune and precisely set your devices for what you need in each situation of your life. And then the third piece that's important is you need to do your part as well. So that means wearing your devices regularly, getting adjusted to them, because it is like relearning how to hear when you start hearing all these sounds around you again the way that you should be. It takes time and practice to get good at really focusing on those important sounds like speech, and starting to get better at tuning out some of the other sounds that you don't want to hear. And really also communicating. You work with a professional for a reason. They're there to support you and help you. And if you're having any issues whatsoever, you need to communicate that with your hearing professional so that they can resolve that and work with you.
I think I have the pleasure of being the comedic relief for this presentation, which is great. This is a selective hearing aid that probably a lot of maybe men or husbands have. It has three settings: TV, off, and the wife setting. And unfortunately, it turns off before it goes up to the wife setting. So this one is not Bluetooth. It is not rechargeable. It's not automatically adjusting. Probably more closer to an earplug than a hearing aid itself. Anyway, just a little funny one. Some of you may know somebody who has something like this.
I have one like that, but mine has
Yeah.
husband on top.
Okay, you have one yourself. Okay, it goes both ways. Absolutely. Yeah. So all of this presentation just really, we hope that it outlined all of the different aspects of hearing and how it can impact your social, your emotional, physical, mental well-being, so many different ways. Better hearing is not just better hearing, but it has so many other links to an overall increased sense of well-being. So improved relationships with your friends, family, loved ones has a lot of benefits for your overall brain health, that big cognitive decline and dementia risk piece, what we talked about a lot. It increases your confidence and increases your independence, helps you to be more socially active and engaged through better hearing, and you have more energy. You don't have to think so well about hearing if you are hearing at your absolute best. There's more energy left over for other things, spending time with your loved ones. So all in all, if you suspect that yourself or a loved one have signs of decreased hearing, it's really important to take action early. Just the implications it has on not just your hearing health, but your overall health, brain health, are incredible. So we really thank you for having us this morning. We're pretty much at the end of our presentation. We had a few questions received through a sign up yesterday, but we'll open it up, turn it over to Catherine. Thank you.
Thank you so much. Well, we do not have any questions in the chat just yet.
Sure.
We had a couple of questions during registration. I'm going to read those out now in a moment. But I do actually want to just go back to a few things that you talked about in your presentation. And one thing that you mentioned, Karla, is that we really shouldn't be using Q-tips to clean our ears. So what should we use?
So, I mean, a lot of family doctors will syringe ears if you feel like you have a buildup. There are wax kits that you can purchase over the counter in the drugstores or from hearing clinics. Typically, they consist of earwax softening drops and maybe a little syringe that you can use yourself at home. And it's safe to use as long as you haven't had any issues with perforations in your eardrums or ear surgeries. So you might want to just check with your doctor or your hearing care professional before using those kits. But they are quite effective. The same thing when you're in the shower, a lot of people are worried about, getting water in their ears, but flushing your ears in the shower and directing the water in there can be a great way to help keep the wax under control. Again, as long as you haven't had perforations or issues with surgeries, ear infections, you do want to make sure, before you get water in your ears that's okay. Your eardrum is intact.
The dangers of a Q-tip are just that you can end up pushing wax in a lot further and closer to your eardrum. And like that visual on one of the slides before, where wax was right up against the eardrum and causing some hearing loss. Definitely that can come about through Q-tip use. And unfortunately, I saw a patient probably within the last 6 months who was using a Q-tip, and his partner came alongside him, and accidentally his arm got knocked, and he did perforate his eardrum, and it was very, very painful. He reported to me, it was a trip to emerge and to see an ENT and everything, an ear, nose, throat specialist. So anything could happen. You don't really know where you're rooting around in there with a Q-tip. So there's definitely safer alternatives. Yeah.
And if you do perforate the eardrum, can that repair itself?
Typically, yeah, it may take a little while, like 4 to 6 weeks or so. It can, but it really depends on the severity of the trauma to the eardrum and a few other factors. But yeah, the eardrum is largely repairable. Yeah.
And the good thing, like we mentioned earlier, there's so many surgical procedures available now that sometimes if your eardrum is really severely damaged, you can have it patched now. There is a procedure where you can have your eardrum patched. But of course, anytime you severely damage your eardrum, even if it heals on its own, you can have some scar tissue that develops, and there is a risk of having an effect on a permanent effect on your hearing for sure.
Okay. We do have some questions there in the chat. So the first question is, one of my friends has a problem with hearing, but really can't afford hearing aids due to the prices. Are there any assistance programs? So are you aware of any assistance programs that are out there?
There are, yes. I know that anyone that has been exposed to loud noise in the workplace, we typically recommend looking into workers' compensation. If a patient gets approved by workers' compensation for hearing loss coverage, that would cover any devices that the person needs for the rest of their lives. Same with other forms of work-related damage, like Veterans Affairs, there's coverage, RCMP, private insurances. And if those funding options aren't available, our province is really fortunate. We have what's called the Provincial Hearing Aid Program, or PHAP. And with that program, you can be seen by audiologists at hospitals, at certain designated sites across the province. And if you qualify financially, if you're in a really low income bracket, maybe you don't have any insurance either, maybe you're on social assistance, that program is a really great program for people that really just can't afford hearing aids on their own. And that program is also available to all children 18 and under who have hearing loss. They can get hearing devices fully funded through that program.
When I send the follow-up email to the after this presentation, once the recording is posted on our YouTube channel, the follow-up email will include different information about some of the subsidy programs that are available, such as a provincial hearing aid program. So just to let people know on the call that this will be in the follow-up. Another question that we have in the chat is, if you have a hearing loss due to antibiotics, is this a permanent damage to your hearing or permanent loss?
Yeah, it would really take a hearing test to confirm it. But a lot of times those certain ototoxic medications, they can mostly affect the inner ear and result in a sensory neural hearing loss, such as what Karla had talked about. So it may be a permanent degree of hearing loss, but it would take a thorough hearing assessment to truly determine the nature of your hearing loss and whether it could be medically corrected or whether the best treatment for it could be a hearing device.
And probably we should point out that antibiotics that do damage to the inner ear are usually higher doses than what you would just take, for a cold or a flu or an ear infection. It's usually takes quite a high dose of antibiotics before we start seeing permanent damage showing up.
Okay. There is another question in the chat, just to let that individual know. I'm going to get to your question now in a moment, but I'm going to go to a question now that was asked during registration. Does a hearing aid help you with the sharpness or tone of sound, or does it just make it louder in your ear?
Yeah, the tone, absolutely. So a hearing aid is tuned to an individual's specific degree of hearing loss. And there are so many different kind of shapes and configurations of hearing loss. And somebody may have some hearing loss that's more in the higher pitches or higher frequencies that relate to the clarity and the treble, we'll say, of certain sounds. Someone may have a hearing loss that's more in the low pitched tone. So the bass and the volume, they may be missing some of that because of their hearing. So whatever their hearing loss looks like, it should be programmed to their individual degree of hearing loss across their hearing spectrum, essentially. And it can, of course, help with the tone, the clarity of things. It will take up the volume of things around you and make everything a lot easier to hear. So the tone is definitely a big one, yeah.
And that's where the professional piece comes in, because a hearing aid can only be as good as your professional has programmed and fine-tuned it to be. You can have the best, most advanced hearing aid in the world, but if you didn't have a really thorough hearing assessment and a really thorough fine-tuning session, with some of today's advanced technologies and in-ear microphones, and had everything adjusted to what you need for your hearing, then it might just sound like everything is louder and not clearer and sharper.
Okay. Another question during registration: is hearing loss hereditary? And if so, what can you do to avoid it?
Yeah, it is hereditary hearing losses are quite common. Actually, in this province, there are certain areas where there are specific types of losses that have been researched quite a bit. There was a group that worked at MUN in conjunction with some professionals from Western University in Ontario, where Ian and I graduated.
Yeah.
That have been studying genetic hearing losses in the province for quite a number of years and finding some really interesting genes that have contributed to certain types of losses. In terms of what you can do to prevent hearing loss, if it's in your genes, sometimes it can't be avoided, but protecting your hearing is even more important. If you know that there's hearing loss in your family, you might be more susceptible to hearing damage than other people if you do have a history of family hearing loss. So even if you're using things like tools at home, lawnmowers, snow blowers, going to concerts, really the importance of wearing hearing protection would be even greater if you know you have that family history.
Yeah, and with a few other conditions that may correlate with hearing loss, such as diabetes and other cardiovascular concerns, just generally staying as healthy as you can and exercising, eating well, doing things that are good for your overall health have a lot of positive impacts on your hearing health as well.
Okay. Thank you. We're starting to get a lot of questions in the chat there now, but I'm still going to continue to read the questions that are in during registration first before I move along to chat. Another question during registration. I was wondering, how much effect does the constant use of earbuds have on the ear?
Depends on the loudness of music or whatever you may be listening to. You can listen to music and other things through headphones at a safe volume for, well, forever, essentially. It's only if it's past an unsafe level and for a certain amount of time that it could potentially do damage to your ear and your hearing. Consistent use of earbuds, say all day, may increase your wax production in your ears because there's something that's kind of blocking the way a little bit. But one thing that I especially like through a lot of smartphones nowadays and iPads and certain things, there's safe exposure limits. So and make sure that they're enabled on whatever device that you're using if they have it. But it is something that a notification will come up if you are listening to too high of a volume for too long of a period of time. And it will let you know that this is potentially unsafe for your hearing and you should reduce your volume if you choose to keep on listening. So earbuds and headphones themselves, I don't consider them unsafe, even if consistently worn, but it all depends on the level. And another thing is your surroundings, essentially. So say if you're on an airplane or you're running on a treadmill and there's like a high level of bass noise around you, then most people really do raise up the volume of their headphones to kind of compensate and put their music above the baseline level of sound that's around them. And while it might sound comfortable to them in that environment, it's actually a lot louder than what you would listen to it in quiet. So being mindful of that. Even noise reduction in headphones is really effective at helping people listen at a safe level, but maybe not every device has that. But Yeah, generally, all depends on the level that you're listening at and for the length of time too.
Okay, thank you so much. So we're going to go back into the chat for questions there now. And it says, just wondering why I should choose Maico hearing aids and not others. So other hearing companies and businesses. So this is your time to shine.
Our elevator pitch.
Your elevator pitch is right.
Yeah, I think I mean, there are a lot of great hearing clinics, but we certainly do focus a lot, like I said, on hearing health and making sure that our diagnosis is correct, that we do a really thorough job of understanding people's hearing loss and their challenges, and really taking the time to properly fine tune, use all the most advanced equipment and best practices to make sure that people get the best experience with their technology, and really following through with people. Even if they don't require hearing aids, if they require something else like auditory training, a referral to an ENT for a surgical procedure, making sure that, people get the best treatment possible and are followed through and monitored and supported in the long run. Especially with the hearing devices, because you can't just take hearing devices and go home and not come back and see us anymore. You really develop a relationship with your audiologist, and having things that some of these like smaller family-owned clinics like ours can provide, like loaner programs, if anything ever happened to one of your devices and you need it repaired, or some of the family counseling and training programs we provide. I don't know if you have anything to add.
Well, it's just one of the things I really enjoy about working here is that and this is something that I think Karla has built into every Maico across the province, is that I really am able to spend a lot of time with my patients to make sure that their hearing concerns are met, their devices are tuned perfectly for them, not just in one-on-one conversation, but every environment that they find themselves. And I did used to work at a clinic where I didn't have much time to spend with my patients whatsoever. And it just wasn't set up to be able to address any programming concerns or if they were having a particular hearing issue in one kind of environment. So the connection to our patients piece is something that I really cherish and value here. And having that, we're not here to get you in and fit you with hearing aids and hope to never see you again. We want to see you and we want to continue to have that relationship with you and make sure that you're doing really well with your hearing, and if you go for technology long into the future. So it's nice. I've developed so many connections with my patients over the last 2-3 years of being here. We're definitely on a first name basis, and just they haven't sent me any letters in the mail or added me on Facebook or anything yet. I don't really, but they're really strong, good relationships with our patients, and I love it, to be honest.
Thank you both for your answers. How long does a hearing aid last in terms of years of usage?
The average is about 5 years. I've seen many people with hearing aids that are much older than that. Technology changes a lot, well, even in the span of 1 to 2 years. So over a 5-year period, it's almost a night and day difference. It definitely can be in technology. There's warranties from the manufacturers and of course things like that, but the general time frame is about 5 years or so. Do you agree?
Yeah.
Okay. The next person that asked a question, they actually asked 3 questions. So you're going to have to bear with me now while I read one question out at a time. So it says, thank you so much for the presentation. And then they have a few questions. First question is, I think there is, let me see. I think there is hearing loss related to autism. Where do you draw the line between a hearing loss due to environmental effect or due to genetic factors and the one related to autism? What are the remedies? What remedies are available?
That's a tough one. I mean, there are so many different links between hearing loss and different health conditions. I mean, I think most often hearing loss that is associated with someone with autism is probably picked up now at a pretty young age. Thankfully, due to all of our infant hearing screenings, our preschool screenings, that we've really come a long way with monitoring hearing loss. So we're really fortunate now that we're able to pick up on those types of losses a lot earlier than we did years ago. So I think that the type of treatments might be very similar to, if you have a sensory neural hearing loss or a conductive hearing loss or whatnot, without any type of other issues. But we do find one big thing when it comes to autism is that you might be a bit more sensitive to sounds. So we would really take that into consideration even from a very young age, even before children might be able to really verbalize to us, this is uncomfortable. They do verbalize it pretty quickly with their actions, though. But that is something that we take into consideration with that fine-tuning part, and really working with them for sound sensitivity treatments and trying to help gradually toughen up their ears and get them more comfortable with everyday environmental sounds.
Yeah.
Do you have anything to add?
Yeah, there's just quite a few factors in that question itself, and environmental concerns relating to developing hearing loss. Well, of course, excessive noise exposure is a really big one. But yeah, like I was just going to add, if you hadn't, just the sound sensitivity piece that we see in people with autism, that can be a big one to work on. So if there's hearing loss, and devices are recommended, because it is going to be really beneficial for them to have access to as much speech as they can, of course, as with anybody with hearing loss. But knowing if there's any sound sensitivities present, that has big governs how someone may fit their devices and program for their specific needs.
Okay, thank you. Second question. I heard from you that the neural type, I know I pronounced that wrong, neural type of hearing loss is permanent. I hope I'm right, and if so, how do people with this kind of hearing loss, especially from noise damage and auditory tumors, cope with their social life? And is this a possible treatment?
Yeah, well, a sensory neural hearing loss, lots of different factors can cause a sensory neural hearing loss, so a hearing loss that stems from the inner ear. But something that we had said earlier on one of the slides, that probably the most common treatment for a sensory neural hearing loss is really a hearing device or a hearing aid at that. And if that device gives back the access to sounds that people are missing because of their sensory neural hearing loss, whether it be because of noise exposure or damage to the inner ear, absolutely, they can have a totally fulfilled life with great social well-being and connection to others. The hearing device allows them to participate and not have their hearing loss get in the way of what they like to do. And in my experience, I have seen some people who do have a sensory neural hearing loss from an auditory tumor. Sometimes it's very well treated with a hearing aid. There's other options as well that sometimes route the signal to a better hearing ear, and people still have balance and surround sound and everything. Say if that ear is quite down in terms of the hearing, and a traditional hearing aid may not work as well. So there's lots of different technologies that are out there that help people to really manage a sensory neural hearing loss, kind of no matter its origin. And we work with it every day, really. Yeah.
Okay. And the last question is, I am curious to know how some auditory aids combine the use of Bluetooth device and headphones, and also serve the medical purpose of treating the specific hearing loss. So I'm not sure if that person wants to come off mute just to kind of elaborate what your question is. if you guys think you can answer this without
Yeah,
any further
okay.
clarification, that would be great.
Yeah,
Yeah, I mean, they nowadays the technology, they are little computers, little mini customizable computers. So it's really quite amazing what they can do. They do have features that allow us to tune every single pitch for what a person needs, as well as what kinds of background noise features the person might need turned off or activated in certain situations. So all of that can happen in the background based on our tuning. And then when a Bluetooth device is connected to them, it does switch into a Bluetooth mode, but it maintains the adjustments and the tuning that we did for the person's hearing loss. So what you're hearing from, the Bluetooth streaming on your phone or from your television streaming Bluetooth, it's not just a standard sound like you would get through regular headphones.
it's
It's
tuned
that
for your.
customized sound.
Yeah.
Yeah.
Yeah. And the Bluetooth side of it as well is that hearing aids are able to automatically adjust to certain listening environments, but some people really like to have a degree of control over their listening experience too. So with a Bluetooth connection to your cell phone or your tablet, there are a lot of free apps that you can download. Manufacturers of hearing aids make them to work in tandem with their devices, and people can change little things such as background noise reduction and switch into different listening settings, say if they're outdoors or if they're in a restaurant or a crowded environment. So the Bluetooth side of hearing technology, I'm really excited about that. And that's come a long way in the last like 7 or 8 years or so. It's not necessary for someone to do really well with their hearing aids if they're not a techie person or anything like that. It's not something that you need to have in your devices or use all the time. But it definitely it benefits a lot of people. The phone calls are a great one too, because hearing on the cell phone is sometimes a challenge for people. So to have that at the ear level through your hearing devices and tuned to your degree of hearing loss at that, really, really beneficial.
And like Ian said, it's really exciting. Like there's one manufacturer now that has actually released a device that is going to start to be compatible with systems in places like airports or museums or the Arts and Culture Center. And these public places are all getting on board with this. It's going to be worldwide. It's really exciting to us as audiologists. But if you are in an airport and you're having trouble hearing the announcements, you can actually hear the sound system in the airport near you come right through your hearing aids if you want to allow that.
Yeah.
And it's really exciting. It's going to really change how people hear and interact in so many different environments.
Yeah, it's very neat. And hearing aid manufacturers were among the first to do it. And it's pretty cool that now other audio companies are catching up now. I suspect within the next 1 to 2 years that'll be a pretty common thing around the world. Yeah.
Okay, thank you. Now, Ian, I'm going to ask you to stop sharing, so I'm going to share my last slides, but we still have some questions in the chat, so we're going to continue with that. Just going to go ahead and share my screen first, everybody. And then I'll move on to questions in the chat again.
Pick the appropriate outfit for today. Just like my picture, hey?
What is the range of cost for hearing aids?
I think there's a really big range of costs. Number one, because there's a lot of different brands and different levels of technology. But more importantly, I think that a lot of hearing aid packages that you see, particularly in Newfoundland, They are packages. You're getting a lot of services. I know that's how we do it at our clinic. So you're not just purchasing a hearing aid and going off and saying goodbye. You're getting 5 whole years of like cleaning and maintenance and programming adjustments and counseling, and a lot included. So I probably, as a clinic that offers that, I can really only speak to our packages and what our ranges are. But I would say anywhere from around 1,500 per side for your package for 5 years, up to, I mean, you can get some quite advanced packages, maybe around 3,500 per side. That would be a typical range for a hearing care service package for 5 years.
And it's quite a big range, of course, like Karla said. So the best thing is to really sit down with an audiologist to see, well, what kind of level of devices might be best suited to your listening needs and lifestyle. If you don't necessarily need some of those higher end technologies because you're not in those environments that really need that advanced noise reduction and things like that. Absolutely. There's a whole range of devices that may help you. So picking out the best ones that are exactly for you and your needs is something that we would do.
And is there direct billing?
Yes. Yeah. Yeah.
Most insurances now do allow hearing clinics to direct bill.
Mm-hmm.
Okay. And do you hold clinics in Labrador?
We don't right now.
Not at the moment.
Moment,
No.
you never know. We're expanding all the time. We're really fortunate right now. Actually, we have the largest network of registered audiologists across the province, aside from the provincial government. And we're always, growing. And who knows, as we expand our team, maybe we will get to go to Labrador again sometime.
Okay. That was the last question that was in the chat, but I do actually have another question for you. During your presentation, you actually mentioned fall balance. And one of the things that we, talk about, we try to educate on a lot is fall awareness.
Mm.
So how does the hearing affect the balance when talking about fall awareness?
Yeah, well, your inner ear, going back to that visual of the little snail-shaped looking thing there, your cochlea is side by side what we call your vestibular system. And that is one of the main balance centers of your entire body. And it tells you where you are in space and everything like that. And that can be a source of dizziness and balance and fall risks for people. So where the inner ear is so closely linked to that, any reduced input to that inner ear can also kind of reduce the input to the balance center there and cause people to feel unsteady, imbalance, some forms of disequilibrium. The inner ear as well, that vestibular system can also be related to vertigo, as it happens through a couple different conditions in there. Single-sided hearing losses, so if one ear is further down in terms of the hearing than the other, that can make people really feel off center and off balance too. So yeah, hearing and balance really closely related, and treated hearing loss has a lot of positive implications for fall safety, benefits for fall risk, and just, yeah, your overall steadiness and balance. Yeah.
And some of you may have heard as well, this is a common thing that can occur for people. There are little crystals inside your inner ear that can sometimes become displaced. So that might cause those vertigo or spinning sensations, like the room is spinning around you. You may even get some nausea with it at times. And oftentimes that's something that can be easily treated and repositioned. It can reoccur, but it is something that's actually quite common and is not a serious problem. But anytime you do experience any dizziness or balance or vertigo issues, we do recommend to get it assessed to ensure that it isn't something serious or something medical underlying if it needs to be treated.
Okay, thank you very much. Does anybody have any additional questions for Karla and Ian? Going once, going twice. Okay. So I would like to move to our next screen. So our next session for Let's Talk About will be June the 12th, and it's going to be Let's Talk About Elder Abuse. It's Not Right. Our other session in June will be on Wednesday, June the 19th, and it's going to be Let's Talk About Your Time to Shine. If you have, before we go ahead and clue up the call, anybody have any additional questions for Karla and Ian? Again, your time, take yourself off mute, enter another question in the chat. Let me just bring up my chat screen again. No, I don't see any other questions there. Well, I would like to thank Ian and Karla for joining today, and Maico Services. This presentation, I have to say, was extremely informative. I've learned a lot from just listening to how the hearing works and the different types of hearing losses there are. I will be reaching out because I do have issues myself in crowded areas. I cannot pick out what anybody's saying. So this has been for as long as I can remember. So it's nice to actually learn a little bit about that today. I would like to thank everybody for joining the call. If you have any questions or concerns, please don't hesitate to reach out to Seniors NL. The number is on the screen. If you are viewing this recorded session on YouTube and you would like to have the email follow-up to this session, please reach out to me at outreach@seniorsnl.ca. Thank you, everybody, for joining, and have a lovely day.
Thank you guys so much. Mhm.
Okay, thank you. I'm going to end the meeting for everybody. Bye.
See ya.
Bye.